Thank you very much for joining us from the British Medical Association Council. We are responsible for so many doctors all across England, and you're fighting hard for their safety and for looking after them. We found these reports, I don't know if they're correct and whether you could actually clarify this, that a lot of British Asian doctors, that Indian doctors or Asian doctors generally in England have been a higher proportion of deaths. Is this proportion higher than the norm for all doctors? And is there any particular reason why more British Asian doctors are dying than other doctors?
Yes, so the first 10 deaths in the UK, the first 10 doctor deaths were all from black and Asian minority backgrounds. And all of them, except one, has come from overseas. And this is particularly tragic and sad because these are doctors who have come to the UK, they've given their lives to the National Health Service, they've saved others' lives, and in the process, they now have unfortunately died. We also have a far higher proportion of ethnic minority patients who are hospitalized in the UK. About 33% of intensive care beds are occupied by patients from ethnic minority backgrounds. Twice as many Asians are in hospital in intensive care beds compared to white patients. And we occupy only about 13% of the population. So disproportionate effect on Asian and ethnic minority population and also doctors.
Why? That is a bit of a worry. Why is this happening? Is it a worry for all Asians in general? Should we in India be worried that we're a little more prone to it? Or is that an exaggeration and you can't really extrapolate from what's happening in England to here?
Well, it is certainly a worry. These statistics are concerning. Because it's a new virus, it's a novel virus, no one can actually say we quite understand why, but we are looking at it, and I've called upon the UK government to urgently investigate and take action to mitigate the impact on our Asian and black population. Now, one of the reasons that has been put forward is that many of our Asian populations do suffer with what we call comorbidity, higher levels of hypertension, higher levels of coronary heart disease and diabetes, which added together places a person at much higher risk of the infection having a more serious effect. What we're looking at now is whether we should stratify ethnic minority doctors and protect them from front-facing care of patients with COVID. That's what's being looked at. That's one possible reason. Another factor that is of concern is that in terms of our key workers, so we have a lockdown in the UK like you have in India, but hundreds of thousands of people still have to work to keep shops open. We still have our transport still functioning, so bus drivers, train drivers, care homes, and of course healthcare workers. Now those key workers are mixing with others. They can't be at home, so they're probably more exposed to the virus. And as I said, a larger proportion of our key workers are from ethnic minority backgrounds. And that may play a part as to why the infection is affecting ethnic minority population greater. There's a third factor, which is in the UK's overcrowding. The proportion of our ethnic minority population who are in overcrowded houses is far greater than the white population. And as you know, we live in extended families with multi-generational households. So you can have younger members of the house going out to work, doing essential work, coming home and spreading infection in the same household, especially the older population in the household who may be vulnerable with lots of other medical conditions. Another reason why we think, there's another reason why we think this is happening is also because of the lack of public health messaging being understood by some of our ethnic minority communities.
So you've been fighting a lot for more PPE, personal protective equipment for doctors in the United Kingdom. which even in the United Kingdom, that's in short supply. What about a poor country like India? Protective equipment for doctors. What message can you give from what you've learned for a poorer country like India?
India must plan, and we have also now resorting to domestic manufacture of protective equipment. So I hope that India will be ensuring that it has sufficient stocks because the pandemic has a huge demand on masks, gowns, eye protection, and so forth. And also there's a global shortage. So countries like China actually don't have enough to deliver to the whole world. So my advice would be, please look at having enough domestic production in addition to imports, because ultimately, if healthcare workers are not protected, they will fall ill. And if they fall ill, they won't be there to look after patients. It's probably one of the biggest issues for the medical workforce across the globe, which is shortages of personal protection equipment.
So, Dr. Nagpaul, basically it's been more than 100 days since we recognized this as a pandemic. This crisis is much bigger than we initially thought. If you knew then 100 days ago what you know now, what have you learned in these 100 days and that would have changed your approach at the start if you had known about it and had this experience already?
I think the first thing is that any nation at the earlier stages should be expecting an unimaginable escalation of the virus spread in a way that can occur within days and weeks. So to plan for that worst right at the beginning. Now that means making sure that the nation is prepared with proper capacity and capacity that it may not have in terms of medical beds, ventilators, facilities. So in the UK, we have now opened up 3 new hospitals, converted a massive exhibition center into a hospital in London, for example. China did very similarly. So I think that the plans to really massively ramp up hospital provision is vital right at the early stages. Now that also includes equipment, because of course the issue around COVID-19 is that patients need ventilation when they're seriously ill, and most nations will not have the equipment readily available. So you need to plan to either import where you can, but there are worldwide shortages, but also look at domestic manufacturing. So we have in the UK used companies that have never built ventilators. I think Mercedes, for example, are building ventilators for the UK now and repurposing manufacturing to achieve that. And I can't emphasize how important that is, because this condition in its stages of critical care require this sort of equipment. The third is testing. That I think many nations perhaps haven't done as well as China and South Korea.
Yes, I think these are really important messages. Just to ask you about testing, there's so many different types of kits from different companies. Some are very well-known companies, not so much. There's this rapid antibody testing. There's this new NAT testing. What should a country do? I feel that England made a bit of a mistake. We in India are using the normal PCR test, which is a little expensive, takes long, but it is a good test. But can it be used for hundreds of millions of people? And England made a mistake in ordering. What have you learned that India should take into account in ordering different types of test kits?
I think it's really important with any test kit to make sure it's validated. There's been reports of many kits that have had high levels of false results, and that is what you don't want is to give false information and then take public health decisions on those false readings, sometimes error rates of around 30%. So it's important that any nation properly validates and checks the accuracy of tests before making it widely available.
And now, of course, this 30% kind of error rate, the test can be very good, but the sample method of collection that you use a naso and throat swab, that's not done too well, so the test cannot actually, so it's not just the test, it's the way you actually collect the sample. But finally, Chaand, Nagpaul, are you more optimistic now than you were, say, a month or two ago? And how long do you feel this crisis will last, in your view? That's an unfair question, but I'm going to just would like to hear that from you.
I don't think any of us can take a view about being optimistic. That would be providing false assurance or complacency. We have to take each day as it comes and give our fullest attention and efforts in addressing this virus. It wouldn't take long, for example, even if you had suppressed the virus, for it to come back if there was any relaxation on the public health measures to shield, to isolate infection and so forth. So there is no room for complacency or optimism at this stage. So what I mean, as I said, we are still in the UK planning to expand our capacity for patients requiring hospital admission. That surge can occur in a very short period of time. The other thing is workforce, because this pandemic is creating an enormous demand on medical workforce, doctors, nurses, other healthcare workers. So in the UK, we have brought back significant numbers of our retired doctors to come back and contribute to supporting the workforce. Medical students have also been fast-tracked in their final years of education to become doctors, to add to that workforce.
So in all your planning that you're doing right now, how long are you planning for this crisis to last? Preparing for the worst, and how long would that be?
Well, it's certainly not going to be over in the next week or two. We've actually got our highest risk patients, some of our most older patients, those with severe underlying medical conditions, who have got a 12-week shielding arrangement where they are literally going to they are staying at home and not even communicating with anyone else, because they would be at greatest risk of serious illness. So we're planning for months. I think that there may be, if we are fortunate in many nations, we may see some relaxation of the levels of social isolation. There may be some opening up of work, but that's not going to come, I don't believe, in the next week or two. It may be in a few weeks' time, and even after that, it would have to be done in a very graded way. And I believe that mass testing, will have to continue. And I hope by that stage we've got the antibody test, because even if you feel that that you're through the worst, it's important to keep a measurement and monitor the level of infection in the community should it start to increase again.